Many patients come with the hernia and they want to understand basically what is the hernia. Hi everyone, I am Dr. Prashanth, consultant surgeon in the Department of General and Minimal Access Surgery at Apollo Hospital, Bangalore Road. Today I am here to talk about one of the common issues which we come across in the surgical practice, that is hernia. So as a definition, hernia is a protrusion of a viscus or a part of a viscus through the abdominal opening in its containing cavity. Now, what are the risk factors or the causes for the development of the hernia? The hernia develops because of increase in straining, be it while passing the stools. Whenever the patient is having the constipation, he puts a lot of pressure to pass the motion. This increased straining will cause the rise in the intra-abdominal pressure. This in turn leads to the development of the hernia. The other cause is straining while passing the urine. If the patient is more than elderly, aged more than 60 years, if he is having prostate enlargement, that is called as a BPH, then whenever he passes urine, he has to put pressure to pass the urine. This also leads to the development of hernia. Those who are chronic smokers, they in turn develop hernia because of the smoking effect, which causes the chronic cough. Whenever they cough, it again raises the intra-abdominal pressure, and this in turn leads to the development of the hernia. And other cause for the hernia development is any previous operations. Any scar which is there in the abdomen, which has been undergone, he has undergone an operation previously, over the period of time, they tend to develop the weakness in the scar. This in turn leads to development of hernia. When the hernia is present with birth, then it is called as the congenital hernia, which can be umbilical or congenital inguinal hernia. Now, coming to the symptoms with which the patient comes. Whenever they strain, they have noticed a bulge in the abdomen. If it is bulge is in the umbilical region, it is called as the umbilical hernia. If it is in the groin region, it is called as inguinal hernia. So, one of the symptoms is the bulge and associated with pain. Now, what are the types of hernia? Commonly we encounter the inguinal hernia, umbilical hernia, the femoral hernia. These are the common hernias which we come across in our surgical practice. Next is how to diagnose the hernia. Usually the clinical examination itself is sufficient to diagnose the hernia, but rarely for confirmation of the diagnosis we do USG of the abdomen, ultrasound scan. That will give a clear picture as to the size of the hernia and also what is the content of the hernia. And some people, in these obese patients where it is difficult to diagnose with clinically, then we suggest CT scan of the abdomen, which will give a clear picture as to where exactly is the hernia, or if there is any other defect, what is the size of the defect, and if there is any divarication of the muscle, and the condition of the weakness of the muscles can also be made out.